Welcome back. My name is Jennifer Robum, licensed clinical psychologist and faculty for the Family Medicine Residency of Western Montana. I'm talking to you today about climate change communication. In this segment, I plan to highlight the critical roles that health professionals can play in communicating about climate change and its health impacts. You'll note that I've used the image of a water droplet here to highlight the ways that communicating with others about climate change is an important way to enhance the ripple effects of our efforts. So what roles can health professionals play in climate change communication? Others have written elsewhere about possible roles that family physicians, psychologists, and other health professionals can play in climate change mitigation and adaptation. I've broken such roles down here into 4 categories: citizen or personal, provider, educator, and advocate. There's some overlap between these categories, but my main motivation is to emphasize that there are many ways that you, as a health professional, can communicate about climate change. The first category is citizen or personal. As I indicated earlier, people trust their closest contacts for climate change information even more than their healthcare providers. So many people are swayed by everyday conversations with their family, friends, and colleagues. Talking about climate change and breaking the spiral of silence in your personal life may be one of the most important things that you can do to raise awareness and help to change attitudes. Not all communication is verbal. Your behavior is another form of communication, and you can lead by example by modeling climate-friendly behaviors in your personal life. For example, walking or biking to work, recycling, flying less, or eating less meat. You can even communicate with your wallet by buying an electric vehicle. From a carbon footprint standpoint, your personal behavioral choices may be relatively insignificant in isolation, but they could prove significant in the aggregate, and they could help to change social norms in your community. Depending on your personality and values, you may also choose to engage in other activities or activism related to climate change in your personal life, be that volunteering for local organizations, attending demonstrations, engaging in letter writing campaigns, boycotting corporations engaged in greenwashing, or voting for politicians who are championing renewable energy. Again, these activities are another important form of communication, signaling to others what you believe and what matters to you. The second category is provider. In another segment, Beth Schenk will be talking about the significant contributions of the healthcare sector to climate change. You can push yourself, your partners, or clinic or hospital administrators to green your practice environment to make it more environmentally sustainable. You can also acknowledge the relevance of climate change for health during patient visits, communicating with your patients about the ways that environmental changes are impacting their health and well-being where relevant. In addition, you can discuss the co-benefits of health behavior changes that promote health and reduce climate change. For example, converting to a plant-based diet, utilizing alternative transportation, and driving less, etc. In the clinical practice adaptation segment, I'll be presenting specifically on how to talk to your patients about climate change and its health impacts. For those of you who are not providers per se, for example, public health professionals, you can still communicate professionally about the health impacts of climate change by making sure that attention is paid to them in local surveillance efforts, for example, tracking of vector-borne diseases, in disaster and emergency planning efforts, and in climate change adaptation plans. The third category is educator. You educate your patients all the time, and there are many opportunities to integrate attention to climate change into those discussions. For example, when there's wildfire smoke, you might provide anticipatory guidance around the use of air purifiers or discuss the importance of outdoor exercise restrictions when air quality is poor. You can also hang informational posters on your walls, utilize patient handouts, or leave climate change-related pamphlets or fact sheets in your waiting room. You can also provide more formal education in your capacity as a health professional, either as a healthcare educator, as I'm doing now, or in public forums that value your expertise, such as town halls, public presentations, or the local newspaper. You might even consider creating opportunities for stakeholders to come together to talk about the health impacts of climate change in your local community as a way to enhance community engagement and response capacity. And finally, the fourth and perhaps most important category is advocate. You can advocate for policies, programs, and research to help mitigate climate change and its impacts, using your credibility and platform as a health professional. Such advocacy can take many forms, including testifying in front of the legislature or other decision-making bodies, writing op-eds for the local newspaper or blog posts, and/or joining any number of advocacy groups or coalitions that are looking to reduce the impact of climate change on health. Several of the presenters in this webinar series are board members for Montana Health Professionals for a Healthy Climate, and Lori Byron will talk more about this in her segment on climate and health advocacy. Such advocacy activities will amplify your voice and your impact. In summary, health professionals are uniquely positioned to play many roles in communicating about the health impacts of climate change, be they in the personal or citizen, provider, educator, or advocate realms. I like to think that in these critical roles as climate change communicators, health professionals can leverage their credibility, their trust, and their reach to become important climate change agents. Before we move on, I'd like you to spend a few minutes developing an individualized climate change communication plan. For starters, in your role as a private citizen, ask yourself the following. What are ways that I can bring climate change into more conversations in my personal life? How can I model more personal behavior that's consistent with my climate change convictions? Is there any activism or volunteering that I want to do as a private citizen that would promote climate change mitigation or adaptation? What commitment, if any, am I prepared to make today? In your role as a provider, ask yourself the following. Am I talking to my patients or colleagues about climate change and health co-benefits? If not, why not? What would need to change in order to have those conversations more often? What are other ways that I could communicate about climate change with my patients or community members? For example, through handouts, posters in the waiting room, flyers, my own behavior. What are ways that I could green my practice or office environment? What sustainability-related conversations should I be having with my practice partners, supervisor, hospital administrators? What commitment, if any, am I prepared to make today? In your role as an educator, ask yourself the following. What are ways that I can educate others in my role as a health professional? What educational opportunities can I create, either in my practice environment or in my community, to get the word out about climate change? What are ways that I could mentor others in my discipline about this issue? What commitment, if any, am I prepared to make today? And finally, in your role as an advocate, ask yourself the following. What are ways that I can communicate about climate change at a more systemic level? How can I amplify my voice regarding climate change? How can I leverage my clout and credibility as a health professional? How do I want to become more involved? What's the first step that I'll take? What commitment am I prepared to make today? In other words, I strongly encourage you to utilize what you're learning in this webinar series to become a more frequent and effective climate change communicator and to make a larger difference in your community around this issue, starting today. Thank you.